we won't see this cost $1 trillion over 10 years. It'll cost $2 to $2.5 trillion if everybody who's eligible starts showing up in the exchanges. We are on a trajectory that is a glorified third world debt spiral.
Is the single most fiscally responsible piece of legislation in the last 20 years, not irresponsible, as long as Congress keeps its promises.
If you do the arithmetic, you can easily come up with a situation for anyone who's at 300% of poverty or below, in which it will be cheaper for the employer to drop the insurance, pay the penalties under the law, give the individual employee a raise, send them off to the exchange where they can take their raise and the federal subsidies, which can be as much as $7,000 for a family of making $70,000, so 10% of their income. They can take their raise and the subsidies and buy insurance of the same or higher quality on the exchanges than they were getting with their employer. All that can happen, and the employer can come out ahead.
But we've actually run this experiment, folks. We ran it in Massachusetts. Okay? In Massachusetts, we put in a system with more generous subsidies than the federal government's doing and a much smaller penalty on employers to drop health insurance. So if dropping health insurance was going to happen and sending people to the exchange was going to happen, it would have happened here. It didn't. In fact, the opposite happened.
This act is riddled with anti-growth measures. It has extensive mandates on employers, on individuals. We cripple the small businesses of America as they keep track of where they bought their gasoline. It's got $500 billion in new taxes, whether they're device taxes, fees on insurers, pharma contributions, all of which are going to show up in higher premiums, which are going to show as cost pressures in the business sector. This is a recipe for worse, not better growth. And on top of that, we're going to have $1 trillion in new spending, which is no one's idea of a pro-growth strategy at this point in time.
There is a legitimate criticism of this bill. I mean, defense, legitimate criticism. If you don't believe the government's role is to expand health insurance coverage, if you don't believe the government should spend money to do that, then this is a bad bill.